if it is proven effective, it's going to be a very efficient therapeutic product, because it can be used both by smokers and by non-smokers, with some precautions, of course, as with any medication. But the prospects are there. We just need to look at clinical efficacy first. So we are not saying to anyone that go to a pharmacy and get nicotine replacement therapies or start smoking, of course not. But if we find clinical evidence that it is effective, then it can be used by everyone, not only by smokers, not only by snus users or users of other types of nicotine products. And that's very, very important in the combat against the COVID-19.
Epidemiology data and clinical trials data would prove that nicotine is in fact reducing the risk of, becoming COVID-19 infected and or having, more severe outcomes of the virus. Do you think this could have implications for far less harmful products than smoking, such as snus, e-cigarettes, nicotine pouches, heat not burn, and other products, with regards to legislation and the present ban on snus in the European Union?
Well, I hope it will, because even if nicotine is proven to be effective, we need to convince smokers to quit. But in that case, we would need to tell them that they shouldn't quit nicotine intake. And how are they going to get nicotine when they quit smoking? Well, of course, one option, and I would say the best option, is to use medications, NRTs, but NRTs will not work for the vast majority. So we need to have more alternative nicotine-containing products that really a mistake to tell these people that they should quit nicotine intake. Of course, we should again encourage them to quit smoking, but we should provide them with other nicotine-containing products. And we should make we should give them our recommendations that yes, NRTs are probably the best option, but if you cannot quit with that, you should have other alternatives. Now, for the EU ban on snus, I have called this one of the biggest public health scandals ever in the European Union. It makes absolutely no sense. It is just right now, I think there's no doubt, it is just a political decision that politicians are too selfish to take it back, and it's only that. There is no science behind that. There is no common sense behind that. In fact, it is absolutely irrational. It is extremely disappointing that the European Court did not realize that, and it's even more disappointing that some, sorry for saying that, but laughable arguments were used for their decisions, such as that Swedish men have low smoking rates because they take paternity leave. This is absolutely laughable, but unfortunately it was used as one of the main arguments for maintaining the ban. It is seriously a public health scandal, and I don't know how this will be reverted. It is a very bad service to the EU population.
I was actually there together with my snus friend Uwe Hille from Germany during the trial hearing in the European Court of Justice, and another argument used by the EU lawyers was that it has nothing to do with snus that the Swedish men have stopped smoking. It has to do with the Swedish men's healthy living style. and
but 20 years ago it was very different.
Yeah, they totally forgot about the women.
It doesn't even matter. Swedish men who have a very high rate of nicotine use, but most of it is snus, they are having 3 times lower death rates from cardiovascular disease, lung cancer, and other types of cancer compared to the average in the European Union. That says something by itself. They are ignoring the evidence. There is no argument for the ban. It's just legal games, unfortunately, and political games, unfortunately, which are depriving smokers for a less harmful alternative. In fact, smokers in Europe, outside Scandinavia, they almost know nothing about snus, almost nothing. And don't forget, snus is the only nicotine product with the highest level of evidence from epidemiology on its low harm. We're not talking about a low harm potential, we're talking about proven minimal harm from long-term epidemiological studies in humans. It's not in vitro, it's not modeling, it's truly hardcore evidence, and it's the only product that has such hardcore evidence. So it is even more unacceptable that the EU is not even considering this highest level evidence for snus.
Just last year in October, the Federal Drug Administration, FDA, in the USA approved snus as the first ever modified risk tobacco product. So that should say something.
And it took them a long time, longer than needed, let me tell you.
Yeah, it took them a long time. It's true what you say. I mean, Sweden has the lowest smoking prevalence in all of the European Union, and
yes, but very high nicotine prevalence. The nicotine use prevalence is not lower than other countries. So no, this is another argument and another, clear evidence for the minimal harm caused by nicotine when you don't take it through a product that involves combustion.
That's very true. We are on the average of total nicotine consumption in Sweden, but we use snus much more than we smoke.
Yes,
and we have, just repeating what you said, we have the lowest prevalence of most cancer forms, lung cancer, oral cancer, and cardiovascular diseases, as well as the lowest tobacco mortality in the European Union, perhaps even in the world. I know Iceland